My name is Dr. Rachel Talbot, and I am a child and adolescent psychiatrist with Cook Children's Medical Center. I got into child and adolescent psychiatry because I knew I really wanted to work with kids, and I really enjoyed working with kids with ADHD and developmental disabilities. I actually worked at a camp for kids with disabilities all throughout my high school and college career, and I knew that that was just my calling to work with these kids because I saw how much they really have to offer and how much I could really help them by talking with them, with some of the medications they were using. And so I thought it was just a really good fit for me to go into this field because I love working with kids and I love being able to help them. So when we talk about the common stigmas that parents have for mental health care, we can separate it into two different categories. The first category is about medications and the stigma parents have about using medications for their children. And the next category is about just general psychiatric care. So for example, for general psychiatric care, a lot of parents are concerned that if their child does get mental health care, that it's going to make them feel like an outsider at school, or people are going to know, people are going to judge them. Another common stigma is like concerns about confidentiality, that everybody's going to know your business if you tell it to the doctor. So parents get really concerned about just how others will perceive them and their child if they get psychiatric care. When a child comes into a psychiatrist's office, one of the options that we have available is to use medications. And when I decide whether or not to use a medication for a child, I look at the whole picture of how the child's doing. Are they struggling with their friends? Are they struggling academically? Is their home life, because of their condition, whether it be ADHD, a behavioral problem, anxiety, depression, is their home life suffering because of that? And I take a look at that whole picture and I decide, would this child benefit from having a medication that would enhance their life, that would benefit them so they can work on some of these other issues that they're having with their social life, making it a little bit easier for them to, focus in class or socialize with their friends. So if it's better for the child, that's when I want to look at using medications. I don't want to have your child on a medication, but if I think your child could benefit from it, I'm going to suggest that it's a good idea. So one of the other common stigma concerns that parents do have is that if they seek out psychiatric care for their child, they have done something wrong as a parent or they have failed as a parent. And I'm here to say you have not failed. I tell parents that it is tough out there. This day and age, being a kid is very tough. There's so many academic pressures. There's so much social pressure. We have all the social media. We have this COVID-19 pandemic that we're still going through. All of these pressures are affecting your child. These are things that are out of your control. And, your child is struggling, not because of something you did, but because of everything that's going on. It's a big combination of, like I said, with the school pressures, the social pressures, family pressures, all of that really contributes to the total picture that we see with families. There may be a little genetic component, but really that's just one piece of the whole puzzle that we look at.